Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Good afternoon. I am Dr. Sandeep Yadav. I am consultant neurosurgeon based in Patna. I am assistant professor in PMCH Patna and I run my own hospital in named Mars Hospital, Sangnamore, Patna.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Basically, the brains use tiny electrical signals to control everything we think or we do. A seizure happens when a person's brain is overloaded by an abnormal amount of electrical activity. Some doctors also describe a seizure as a storm in the brain. During a seizure, a person might lose consciousness, shake or convulse, or become confused, or even feel sudden fear or panic.
What is epilepsy?
Epilepsy is a medical condition that causes a person to have repeated seizures. Generally, it is diagnosed if someone has had at least two episodes of unprovoked seizure within 24 hours. Epilepsy can include many different types of seizures, and while some people only have one type, others may experience more than one type.
What are the different types of seizures and do they affect people differently?
Yes, there are different type of seizures. Two types are generalized and focal seizures. In generalized, the entire brain is involved, and in focal seizures, one specific area is involved.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Not always. About half of the adults with epilepsy, uh, we may find a specific cause, but for the other half, common causes include head injuries, brain tumors, or brain tuberculosis. For people above 65 years, stroke or Alzheimer's disease are also a causative factor.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Symptoms can vary a lot, but some common signs of a seizure include sudden convulsions or jerking movements, losing consciousness or starting off into space, confusion, and even sudden fear or a strange feeling. Some people may shake in just one part of their body, like arm or leg. If someone you know has these symptoms more than once, it's a good idea to talk to the doctor.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yes, unfortunately, epilepsy has been misunderstood for a long time. Historically, people didn't realize that epilepsy is a neurological condition and myths develop around it. Seizures can look frightening, so people may react with fear or even avoidance, which leads to stigma.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Triggers vary from person to person, but common ones include missing sleep or fatigue or high stress levels, skipping meals or certain foods, flashing lights, fever, and missing dose of seizure medications. And for women, during menstrual period cycles, hormonal changes also trigger the seizure.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
Several healthy habits can reduce the risk of seizures. I always encourage getting enough sleep as fatigue is a major trigger for many people. Eating regular balanced meals and staying active can also help. Physical activity is generally safe for people with epilepsy, though it's good to avoid extreme or high risk sports without talking to your doctor. And managing stress is essential, and that could mean practicing relaxation techniques, talking to a counselor, or joining support groups.
Thank you so much, Doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Of course, in home, it's wise to clear away things that could cause falls, like cords or clutters, and to pad the sharp corners on tables. In kitchen, use non-breakable dishes, and consider using the microwave when alone rather than the stove. Also, placing the soft carpeting can help reduce injury risk if someone does fall during a seizure.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Just remember with the right treatment, many people with epilepsy can manage their condition well and lead full lives. Being aware of triggers, practicing healthy habits, and having support make a big difference. And remember, you are not alone. There is a community of support out there. Thank you.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.